The study of key nursing theorists. Dorothea Orem is a nursing theorist from Baltimore, Maryland. She made an impact on nursing education and theory by developing the self-care deficit theory. Orem's nursing experience included adult medical, surgical, pediatrics, private duty, operating rooms, and many leadership roles. Orem received several awards and honorary doctorate degrees for her work and dedication in the field of nursing. The self-care deficit theory implies that patients have the ability and responsibility to care for themselves. According to Orem's theory, self-care is defined as activities that are needed to restore, improve, or maintain health. This theory encourages patients' independence with the philosophy that they can heal and recover more quickly when they can execute self-care. The key concepts of Orem's theory include self care deficit, and nursing systems. Nurses play many roles in the care and improvement of patients. To be an effective nurse, one must first identify patients' deficits and needs, then determine appropriate nursing interventions. Orem's theory considers the nurse to be a facilitator, an educator, and a supporter. The nurse is responsible for helping and guiding the patient to a higher level of independence that will benefit their health outcomes. The self care deficit theory is still relevant to nursing today. It is often used to develop the plan of care and goals for patients in rehabilitation and acute care settings. The purpose of the self care theory is to guide nurses with assessing, planning, and implementing care that promotes patient independence. The self care deficit theory provides a great framework to determine care, but there are areas for improvement. One of the limitations of the theory is that it only places emphasis on patients' physical needs. The physical aspects of healthcare are important, however, healthcare professionals must also address the emotional, psychological, social, and environmental needs of patients. It is important that patient centered care is developed and implemented with a holistic approach. The self care deficit theory should also reflect the evolving needs of individuals. Martha Rogers is a theorist from Texas. She was a professor and head of the Division of Nursing at NYU, and she also developed the science of unitary human beings theory. She is well known for pioneering a shift in nursing toward a more holistic and science based approach. Martha Rogers' theory implies that patients have an inseparable connection with their environment. Humans are constantly evolving, and everything in the environment around them have energy fields that are constantly interacting, creating unity. It promotes a holistic approach. Science and art must be used by the nurse simultaneously for optimal patient outcomes. The key concepts of Rogers' theory includes energy fields, openness, pattern, and pan-dimensionality. The science of unitary human beings theory incorporates non-invasive therapeutic interventions such as non-medical therapies, guided imagery, and meditation. It also implies that care coexists between the nurse and the patient and is mutual. It is not just one person giving to another. This theory also teaches nurses to acknowledge the condition of the environment around them and its effects on people. It also reminds the nurse that patients have their own individuality and complexities. Martha Rogers' theory is still relevant today. Although the practice of healthcare is continuously changing, patients and people remain the same. Therefore, this theory still applies. Holistic approaches to patient care seems to be utilized less in Western medicine. The nurse should also consider the patient and their environment to be key factors in their care.